Today we are watching episode 4 of The PITT. It takes place in an ER. I've worked in the ER for 10 years, so let's judge the out of this show, shall we? Editor, please bleep out the
I need rooms cleared and cleaned, so I'm shuffling the deck.
Yeah, but why are you moving him into peds? I'm just about to extubate him.
There's no kids in there at the moment. The family can have some privacy. There's nice pictures on the wall.
Yeah.
What's the problem?
There's no problem.
There is a problem. The problem is you're moving an adult patient into the pediatric section of the ER. Adults and pediatric patients are wildly different in terms of treatment and how they should be taken care of. If your ER is lucky enough to have an adult side and a pediatric side, all the nurses who are working in the adult side do not want anything to do with a pediatric patient, and the pediatric nurses want nothing to do with an adult patient. A nurse who takes care of adults will look at a pediatric patient like it's a fucking chihuahua. You might as well put a chihuahua in front of them, because they're gonna look at that thing and be like, what am I supposed to do with this animal? How am I supposed to take care of this thing? They want no cross-contamination whatsoever. I've worked with nurses in triage. If they see a pediatric patient register into the waiting room, they will find any excuse to leave. They'll just be like, I gotta go to the bathroom, I'll be back, until someone else has taken care of that pediatric patient. That's the problem. And yes, this is very realistic.
Jesus, I don't think that I can go through this. I mean, this is happening.
Yes.
Like now.
Yes.
Like today.
Yes.
We just decided that Dad is gonna die in this room.
Yes.
In a room with cartoon forest animals all over it.
Yes, 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 and yes. This lady has been getting on my nerves these last few episodes, trying to keep her dad alive, which, again, not trying to be insensitive, but it's his time to go.
Good news or bad news first?
What's the good news?
Ear canal is numb. Simple flush with saline will fix the problem.
What's the bad news?
You've got a dead bug in your ear.
Ooh.
Cockroach.
Cockroaches in the ears. This does happen. Sometimes, either when you're asleep or awake, a cockroach or a bug, sometimes a moth, will nestle itself in your ear and get stuck. That's when you can come to the ER and I will flush that sucker out with some saline. Happens more often than you think. The first thing we'll do, the doctor will check your ear, make sure something is in there, and then I will come in with some saline with a syringe and shoot water into your ear to flush whatever's in your ear out. I've never used any sort of numbing thing. He said he numbed up the ear. I don't numb up the ear. I just go in there with the saline and just shoot it. Sometimes what can happen if I am shooting saline into your ear for too long, it could mess up the equilibrium of your head and you will get dizzy. It will be a little painful. So if you're in the ER and you're getting your ear flushed out, make sure to let your provider know when you need a break, because it's gonna start hurting like crazy. I used to love doing these. Watching whatever is in your ear get dislodged, oh, it's like popping a pimple. So satisfying.
Yi Chin, have some Tylenol for Yi Chin. Yes, please. Over here.
There you go.
Yi.
Giving Tylenol.
How much longer until we can see the doctor? We have to wait for a bed to open up. Might be a little while. Pretty popular today.
Yep. Happens all the time, doesn't it? The nurse is giving a patient in the waiting room medication because they've been in the waiting room for a long time. This happens a lot. If you check into the ER, the first thing that happens is you'll get a wristband and then you will speak to a triage nurse. They'll get your vitals, they'll make sure they know exactly why you're here, they'll put it in a chart, and then they will put you back out in the waiting room until you get a room in the ER. If you are in the waiting room for a very long time, because there's no rooms in the back, we will start your treatment in the waiting room. We can give you things like Tylenol, we can start an IV, we can draw blood on you and send to the lab, we can get a urine sample, walk you over to get an x-ray, we could start some stuff. So this is very realistic.
Psych wanted to transition him to oral meds. There's an order for an olanzapine tablet at 9:30 a.m.
Yeah, that's on.
You see that psych patient in that room that's oddly empty? That is on purpose. When we have a psych patient like that, we have to remove everything that's in that room. That means all the little contraptions that are on the wall, the oxygen, the cardiac monitor, vitals machine, the chairs, everything gets removed from that room. That is basically just a square now, and the bed is directly in the middle. He's also restrained with what looks like some soft restraints. He could probably use some leather restraints. There's two types of restraints. There's leather restraints and soft restraints. Soft restraints are like the first level. And if you're a little too crazy, we switch over to the leather restraints, which is a lot more heavy duty.
I've been with criticals all morning. He needs to go upstairs to behavioral health. We're too busy down here to dispense psych meds on the schedule.
Yes!
Understood. What options are we left with?
Yes! There it is. That is another huge problem. This patient is clearly a psych patient. They belong in behavioral health upstairs, but there's no room upstairs, so they have to stay in the ED. The ED is not equipped to deal with psychiatric patients. We are not equipped to give scheduled medications that is necessary for these types of patients. If this patient doesn't go upstairs, they stay in the ED, taking up a private room, which could be used for other patients in the waiting room. This is why you're getting your Tylenol in the waiting room, because we do not have enough space, and it sucks because nobody sees this. Everybody in the waiting room is like, oh my God, why are you guys so slow? What's happening? Why can't I be seen? Bitch, if we get one patient like this, it's gonna take up so much time and effort and resources to calm this motherfucker down. This is very realistic. It happens a lot.
Was she full term at birth? Normal delivery. Childhood vaccines? 2 months and 4 months.
To get an What's your differential diagnosis?
Sick baby.
Check with a rectal thermometer.
Is that really necessary?
It's really important.
Yes. All babies, especially around this age, if they come into the ER, we must get a rectal thermometer temperature. Yes, that means going up the butt, because that is the most accurate way to get a temperature from anybody. But it's very important to get the exact one from a baby of this age. It's a little uncomfortable. Parents, if you've never done it before, if you're seeing it for the first time, I have done many rectal thermometer temperature checks on babies. You want to be careful because if you stick anything in there, it will stimulate the baby and the baby can start pooping. So you want to lay a lot of stuff down so the poop doesn't get anywhere when you're getting a rectal temp from a baby. The other thing that's very important for babies, again, very different from adults, like we talked about earlier, adults and pediatric patients, you gotta take care of them differently. Any pediatric patient that comes in must get a weight. We must have an accurate weight of the pediatric patient because for peds, the medications that we give them are all based on how much they weigh. We must know the kid's weight so we know how much medication to give them. You see how they're different? Adults, peds. You take care of them differently. Nobody wants cross-contaminating.
Why are you sticking me again?
Came in an hour after the chest pain. It's a heart attack. It can take more time for the heart damage to show up in the blood. Put your finger on that. Even with the normal EKG, that's why we repeat the test.
Yes, if you come into the ER for chest pain, we do the EKG, nothing's wrong with you, you're good. I guess in this case, they did blood work for the guy, they sent it off, and the blood work came back fine, said he wasn't having a heart attack. The problem is, he's been in the waiting room for another hour without any sort of monitoring, nobody has eyes on him. So what they're doing is they're drawing his blood again to, rule it all out again because he's been in the waiting room for so long. They're drawing his blood again, sending it off, hopefully still not a heart attack, and hopefully he's okay. But yes, this does happen. Again, this is all because the ER is so busy that we do not have space, that we start treatment while you are in the waiting room. It happens.
We're gonna give the wild one a shot. Have the order. Meds on the way, but we need bodies.
Yeah.
I called ahead. I got kicked last time. Right arm, left arm.
Right leg.
Need one more. Got two more. I'm just here to observe and speak with the patient once he's under control.
Hey, Robbie! Can you help us with Mr. Krakosia?
Nope.
Yeah, right. They're about to hold down the patient and they asked the doctor to help. They asked the attending to help. That never fucking happens. 4 nurses, including the charge nurse, holding down a psych patient. This would not happen. We would have security, we would have techs, we would have CNAs. If this ER is really as busy as they say it is, these 4 nurses would not be available right now, especially the charge nurse. Actually, this charge nurse is taking a lot of liberties in this show. Charge nurses usually are in one spot at the nurse's station and they're stuck there. They're not going all over the ER checking on things. They have to be somewhere where they can easily be found. They're not actually getting in the thick of things, which is their job. They shouldn't. Also, you would never ask the attending to help hold down a patient. They got other things they need to do. Where are the techs? Where are the CNAs? Where's the security? Oh, that waiting room looks gross. That's very
How you guys
basic.
doing?
And thanks. We missed our appointment, but otherwise.
What? But you didn't have an appointment. You didn't have an appointment. Nobody gets appointments in the ER. That does not happen. Don't let this show fool you. You're not allowed to make an appointment in the ER.
I could have gone fishing. I should have gone fishing.
Look at that.
And I'm curious now.
Yeah. She feels bad. She feels bad for missing time. She feels guilty.
I forgive you, Dad, for not being the man that I wanted you to be. But I am so grateful that you weren't. The world needed you to be exactly as you are. It got serious and it turned ugly, and you and your friends built the neighborhood of make-believe. What an incredible gift. Oh, Daddy, I'm so sorry. Please forgive me.
And there it is. It all makes sense now, you know? She felt bad. She wished she would have hung out with him a lot more, which makes sense, right? Now it makes sense why she's been trying to keep him alive, because she feels she hasn't spent enough quality time with him. And so she's trying to get that time back now, which is a little too late. If you got loved ones out there who are getting old, you're thinking about whether or not you should be spending some time with them. The answer is yes. If you love them, spend as much time with them as you can while they're here, because sooner or later, they're gonna have to go, and we don't want you to feel guilty, so you come into the ER and stop us from doing our job. So pick up that phone call and call your mom and dad. I should call my mom.
Med's finally here?
Yep. Guy's got some energy.
Let's do this. Donahue right leg, Larry left leg,
Oh,
Kim
yeah.
right arm,
Here
I
we
pull
go.
left arm, Perla takes the head, and our young man here will inject. Clear?
We're about to
Pull socks.
take down
Right
the
here.
psych
Good
patient.
luck.
I am injection to the mid-anterior left.
I am injection. Intramuscular injection. They're gonna take a medication with a needle and stick them somewhere in his thigh. Intramuscular. As opposed to intravenous, IV, IM. Ah.
Okay, Mr. Krakosia, we're here to help you. We're here to help you. Oh, God.
Here we go. Oh! Ow! He's peeing on. Look at her. Look.
Congrats.
And look who was in charge of the arm that was holding the man's penis to pee on the medical student. The charge nurse! The useless charge nurse who shouldn't have been there in the first place. She wasn't helping. She was in charge of that arm, and she let him completely just whip his dick out and spray that poor medical student.
Congrats, kid. You just earned your yellow wings.
Okay, Midazolam will take him down in a minute. We'll monitor him for 20. After that, the Haldol will have kicked in.
Yeah, he's settling down now.
Do I really need to be here for 20 minutes?
Why? Got a date?
I mean, I'm covered in...
I'm kidding. Thanks for your help. Go get cleaned up.
Okay, thanks everyone. Good work. I know I don't need to say it, but let's
All right, yeah, so they did it. Someone got really dirty in the process because the charge nurse was not taking care of the arm that she was supposed to be taking care of. Is this realistic? Yes, we have had to inject psych patients in the thigh with medications before. Does it usually require 3-4 nurses? If they're available, yes, of course, we'll take them. But for the most part, if this ER is as busy as they say it is, those nurses will be busy and we would be asking security for help. Have I ever gotten peed on? I don't think I've ever gotten peed on. No, wait, yes I have. What am I talking about? I've never gotten peed on like this while trying to restrain a patient.
Okay, I see we're doing a medication abortion today, correct?
Yep.
Well, since I didn't initially assess you, do you mind?
A medication abortion in the ER? That's what they had an appointment for? A medication abortion? The ER does not have time to schedule abortions? What? There's no way. First of all, she doesn't look like she's in any emergency danger, so why would there need to be an abortion? This is something that could easily be done not in the ER. Did you see that waiting room? It's fucking busy. There's people out there who have, I'm sure, crazier things. This is unrealistic.
Is this your first pregnancy?
Yes.
And you're 17? When did your last menstrual cycle start?
Not exactly sure. End of June. 23rd, maybe?
Any allergies to medication?
No.
Any surgeries in the past?
No.
I need to do another quick ultrasound to make sure everything's okay for the medication. Do you want to put on a gown to make sure you don't get gel all over your clothes?
Okay.
The only way I could see this happening is if they know the doctor who said they can come back at 6:30. Like this must be like a favor from like a family member or a friend. But if this is just another random ass patient, I cannot see this happening in the ER. So, appointment for an abortion in the ED? I don't think that's happening.
A little jelly on the belly?
Sorry, it's cold.
Ultrasound to check for the baby.
And just to be sure you're not being treated for any blood clots, taking any anticoagulants?
No, I don't take any medicines.
Okay. Yeah. Oh. What's wrong? Is the baby not moving? What's wrong?
Is everything okay?
Yeah.
Oh, she saw something. I saw no movement on the ultrasound. Maybe the baby is already gone. We don't know. You notice how the patient did not want to look at the ultrasound screen? She was like, I'm not looking at it. She doesn't want to build an emotional connection with the potential baby because she is aborting it. That happens. Pretty realistic. Scheduled abortions in the ED? Not realistic. I am currently on tour right now. Ticket links and dates are in my bio. Please give me some time to get through these episodes. I love them, but I am just a little busy with the tour and traveling. I'm trying to get through all of them, trying to react to all of them without any spoilers. Give me some time. I promise I'll get through them. I'm having a lot of fun doing these, and I hope you guys are having a lot of fun watching them. Come see me on tour. I'll see you guys at the next video. Bye-bye.